Welcome, everyone. We're going to give folks time to log on. We have a very large participant list. We're going to start at 12:05 Eastern Time in about 4 minutes. Please feel free to use the chat box to introduce yourselves. Let us know who you are and where you're from. And again, we'll start at 12:05 Eastern. Thank you. This is Denise Sulzbach. Welcome, everyone. This is Denise Sulzbach. I am the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland School of Social Work in Baltimore, as well as the deputy director of the TA Network. Thank you for joining today's Managing Now for a Better Tomorrow conversation. We will be tweeting throughout this discussion. If you would like to join us.
Welcome to WebEx. Enter your access code or meeting.
Please use the hashtags BetterTomorrow and TA.
Enter your attendee ID number followed by pound. If you do not know your attendee number, this meeting is being recorded.
Apologies for the technical difficulties. I'm going to ask, we do have a panel of presenters. If you are a panelist, please make sure to mute your lines. Great. Okay, so we're going to be tweeting throughout today's discussion. If you'd like to join us, please use Better Tomorrow and TA Network Talks and tag us at the Institute UMSSW. We hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially for the families and the youth we serve. We have created these conversations to have peer-to-peer opportunities for you to talk with the presenters as well as one another. We encourage you to use the chat box to share your thoughts and resources as well as questions for the presenters. You can see many of you are using the chat box now. We encourage you to do that throughout today's presentation and discussion. When you use the chat box, please select all participants. This will allow everyone to see what you're sharing. In follow-up to today's discussion, we will be sending everyone who registered a link to today's recording, as well as all of the resources that all of you share throughout the discussion. As I've said, this is very much a conversation today. You will see presenters joining us from their homes, and we will not be using a PowerPoint during the discussion. And this truly is a series about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. And we may particularly need and value your presentation during today's discussion. As you see, we've already started with some technical difficulties. You may experience them as well. We have a very high number of participants joining us. So if you lose us, please log back in. If for any reason we lose you, we will make sure we have connectivity again. We have a team of solution helpers with us today. So this is a conversation series during COVID-19. Many of you may have joined us for some of our prior discussions. We do have recordings available for crisis communications discussions. We had 2 of them, as well as an in-home behavioral health discussion. We had 2 discussions on supporting families, as well as a conversation on residential interventions. We had 1 conversation on early childhood mental health. We maxed out at 1,000 participants, and we will be offering another one next week on April 29th. We also had a conversation on mobile response and stabilization, and all of those recordings are available on our website, which we'll show you in a minute. We also invite and encourage you to participate in upcoming discussions. In addition to the infant and early child mental health, next week we will also be hosting a school mental health discussion on supporting educators. Earlier this week, we held a school mental health discussion about supporting students, families, and caregivers. And next week's discussion will shift to educators. You're welcome to attend that one. And finally, we have a discussion scheduled for next Friday on rural mental health. We are also in the process of organizing discussions that to be announced shortly on supporting tribal communities and supporting young adults. To sign up for conversations as well as resources during COVID-19, please go to our website, theinstitute.umaryland.edu/COVID-19. And as you know, today's conversation is on youth and young adults experiencing housing instability and homelessness during COVID-19. We have a great panel of presenters and panelists for you to discuss with today. We have Carrie Gold-Kabler, Program Manager at the Institute. Carrie is also oversees our Youth Reach and Thrive at 25 programs, as well as Jay Unick. Jay is an Associate Professor at the School of Social Work here at the University of Maryland, Baltimore, and Jay is also the evaluator for Youth Reach. Also joining us today is Ruth White. She is Executive Director of the National Center for Housing and Child Welfare, as well as Kim Cosgrove. She is the Director of Therapeutic Nursery at Kennedy Krieger Institute. Additionally, we have panelists to respond and engage in conversation with you. They include Blair Franklin. He's the Executive Director of YES Drop-In Center. Ingrid Lochran, Homeless Youth Initiative Director. And Adora Honora, Fellow and Communication Consultant at the National Center for Housing and Child Welfare. So we welcome everybody. Again, please light up that chat box and join us in conversation. And with that, I'm going to turn it over to Jay Unick. Jay?
Thank you, Denise. Thanks, everyone, for taking the time out of your busy schedules and join us for this important conversation about youth and young adults experiencing homelessness and housing instability, particularly during this COVID-19 epidemic. So my name is Jay Unick. I'm the lead evaluator for Youth Reach Maryland and an associate professor at the School of Social Work. The issue of housing instability among youth is certainly not a new one, but it's only amplified and made more challenging by this difficult time where we're all doing a variety of strategies to deal with this epidemic. As the evaluator of Youth Reach, one of the things that has become critically clear, and anybody looking at homelessness, and certainly anyone working with this population knows that it's not equally distributed among all members of our society. LGBT youth experience much higher instability. And in Baltimore City, which has a high concentration of African Americans and poverty, we find it even more associated with African Americans, even relative to poverty here. And a lot of that's related to structural oppression and the lack of housing wealth that's been built up over generations. But a variety of other factors, even with great programs like YES and other programs done by the providers here, we still struggle to maintain an adequate supply of housing for all youth in the city. And this really becomes particularly acute when youth are emancipated from foster care or are really struggling with parenting choices. I mean, particularly in this COVID-19 epidemic, I think a lot of us are really struggling with it. But when you don't have adequate housing resources, it's particularly acute. And so we have fortunately gathered a large group of panelists today that can come help us think through some of these critical issues and have a meaningful conversation. And we know that these youth experiencing homelessness and housing stability face a number of complex challenges and yet manage to deal with them with a lot of resourcefulness and resilience. And so we've decided to focus on two particular areas within this broader topic. First, we're going to explore the challenges that these youth face who are currently in foster care or who have a foster care history. And then we're going to talk about youth and young adults experiencing homelessness or housing instability who are pregnant and parenting. As Denise said, we invite you to type your comments and questions and resources into the chat box. You're not going to hear people talking at you. We're really wanting to make this a conversation. And so we'll send out the information. We'll group it all together and send it out when we send out this recording. So let's get started. Ruthie, thank you for joining us today. As someone who works with foster youth and alumni across the country, as well as with child welfare and housing advocates and policymakers, I'm hoping you can start us off by telling us about some of the best resources and innovations that you've seen as communities implement the response to housing needs for youth and alumni. And again, while Ruthie's sharing with us, we'd love for all of you to share in the chat, and then share some of the innovations that you found that people have been able to do to address housing needs of foster youth and alumni. So Ruthie?
Thank you so much, and I'm really grateful that you guys are having me on this national call. I hope everybody's safe and well. It's interesting because you said innovations, but the reality is the program that I've worked with foster youth to capitalize on has existed since 1990. So we have all of the tools we need at our disposal, and just maybe finding creative ways to make them more predictable, make them properly synchronized and elastic so that they can prevent young people from aging out into homelessness is really important. But you also mentioned families. Kids shouldn't be aging out of kids shouldn't be in foster care. Okay, so that's number one. We should be adequately and appropriately supporting families and meeting their housing needs so that we don't have kids in the foster care system. Be that as it may, it's going to be a few years before we fix all of this. So there are young people that are homeless on the street, and there are young people who are aging out into homelessness. So I want to offer, and we only have a few minutes, so but I do want to take time to offer some resources for your consideration, and maybe you can generate some questions around these. In the middle of this crisis, there really still should not be a young person who's homeless. In fact, HUD took some action on March 31st that create a situation where resources are extremely flexible and abundant, and we should be able to serve all youth currently, so whether they're homeless or in foster care. So I provided some materials to the Institute. I believe they're going to share those with you. I'm going to break it down like this. If you're a young person under the age of 21, you are eligible for Title 4E, Social Security Act funding through the child welfare system. And that funding is elastic and flexible and can pay for rent, hotel rooms, host homes. If you're a young person under the age of 23, you should be able to access Chafee independent living services. And here's the thing, some states have extended Chafee independent living services eligibility to age 23. At this time, we need to acknowledge that every state should have done that. Maryland was one of the first states to do that. That probably is related to the fact that they have the wonderful resource that is the Institute in that state. But the reality is every single state can serve kids up to the age of 23 right now. They don't need to ask for a waiver. They don't need to ask for permission. They simply have to do it now and report it in their Child and Family Services Plan on a report due June 30th, 2020. So there really is no reason why states shouldn't be doing this right now. There's a list on our website and our Facebook page as to the states that have done this, but it should be 100% of states and territories. For young people who are over the age of 23, whether they've been in foster care or not, those young people can now access continuum of care resources for a variety of services. Again, I helped a young man get a hotel room last night. He's going to do that for 4 days, and then we're going to get him hooked up in Illinois with the next step, and then we're going to refer him for a Section 8 voucher through a program that we helped to develop. But be that as it may, HUD issued on March 31st something that sounds like an Avengers character. It's called the mega waivers. And so the Assistant Secretary, John Gibbs, who oversees HUD's entire homeless services portfolio, in fact, an entire department called Community Development and Planning, he issued mega waivers immediately on March, good for 6 months. And it basically says to communities, if you're using HUD's homeless services dollars to serve people, you need to serve whoever you need to serve and serve them without regard to HUD's extremely currently exclusive definition of homelessness, and use them for a variety of things. So, for example, you can use them for emergency services, but you could actually use them to keep someone in their current apartment by paying arrears, which is another word for back rent, and give them up to 2 years of rental assistance under the continuum of care programs. Now, I'll have a lot of pushback on that in the chat room, I'm sure. And folks will say, we don't do that here. We have a resistant continuum of care. I've provided a link to the mega waivers document. You need to expect more. And we're kind of hoping this changes the future for the way these services run. But I want to say that it's not just John Gibbs that's doing a great job at HUD. His career staff are doing really amazing things. And one of the things they're doing is every Friday at 2:15, I believe, the Office of Special Needs Assistance Programs, AKA SNAP, not to be confused with the food stamp program, they're doing something called office hours every Friday, and those are all archived on their website. I've provided links. The Institute's going to send you, we have 4 PowerPoint slides. I know people are over that already, but I have links to all of that. The best one for what you're looking for now is the one they did on April 14th, talks about how the mega waiver changes the Emergency Solutions Grant Program, which again is extremely nimble, flexible, and elastic. So I want to point you to that, but I also want to say, if you're interested in a comprehensive guide of housing resources available generally, including home ownership, affordable housing, rent, whatever, emergency programs, and the Foster Youth to Independence program and the Family Unification program, I really want to encourage you to look at the National Low Income Housing Coalition is a wealth of information, but every year they publish something called the Advocates Guide. The Advocates Guide is every program and how it works, how it's funded, and how you access it on the ground. So just want to encourage folks to dive into that. So I want to hand it over to my colleague, Adora Honora, if she in fact is on the phone. She has a really amazing story. And what her story depicts is how well Maryland does in terms of providing a platform for self-sufficiency for youth aging out of foster care. They do a great job. They can provide any young person who needs it with their own independent apartment from age 18 to like 21, 23. And then they can synchronize the emancipation with a family unification program voucher in many states, and actually throughout the state now because of this new program, FYI, which you can learn about on our website, that youth created the concept and we simply help them create the technicalities of that. So that does exist. But in any event, somebody on the chat room asked where the Advocates Guide is. The Advocates Guide, I provided a link to the Institute, but if you just Google National Low Income Housing Coalition Advocates Guide, it will pop up. Don't print it out. It's like 400 pages. So anyway, do check it out. So with that, I want to hand it over to Dora, if she's on, so she can tell her magical story about how really Maryland got it right for her. If she's not on, I'm gonna blow the lead. Are you there, Adora?
I am.
Yay. Okay, I'm handing it over to you.
Great. Good afternoon, everyone. My name is again Adora Honora. I'm honored to be here to speak on behalf of Maryland and their extremely appreciated efforts in helping youth attain self-sufficiency. So basically, I'll just start with what I learned about how the process is supposed to be handled and how I actually ended up going through the process from a personal standpoint. So with FUP, it's called the Family Unification Program. And it's a program whereas foster care youth are able to be accepted after they emancipate at the age of 21. And it goes for 3 years, and it's a subsidy to the rent for the youth. And they also have aids in helping to seek out these apartments, learn about what to expect with rent and security deposits. They also do aid for the security deposits as well, the county. And so that's a help all in itself. And also, they basically prep you. They give you the guidelines to be prepped for for self-sufficiency after the age of 24. and it goes into FSS. Well, you have the opportunity to go into FSS with it, which is the Family Self-Sufficiency Program. And that it allows you to extend your stay in the program for another 2 years, and also brings in an escrow incentive so that if you earn more income throughout the program, you get matched dollar by dollar by the county, and they put it in an account for you so that when you matriculate out of the program, you're able to receive those funds to do anything that you would need to do, whether it be home ownership or moving out into another apartment, or actually continuing to retain that apartment that you've acquired on your own because it's already in your name, and all of the utilities and renters insurance and everything else is in your name. So it makes it an easy transition for the youth if they should decide to stay in that area. So that is how that's what I'm currently doing. The way that it's supposed to go on before you get into the program is that a year before you emancipate, you're supposed to have a FEM, which is a meeting with all of your social workers and their supervisors, and literally like anybody in your life, like mentors, and they also opened it up to family members that you may still be keeping in contact with if you choose to have them there. And we're supposed to discuss the options that the youth has, because of course a year goes by like that, as we all know. So it's best to be on top of these things with the system, especially being as though so many kids in foster care that are emancipating from foster care every year. So once you have the FEM, they lay out the options. In my particular FEM, I really wasn't laid out too many options because, for one, the reason I entered foster care was because of the loss of my mother, and I was pretty much left in a different country from my father, and he left us there. And so when we got basically picked up by the embassy after a long fight of trying to, secure our place as citizens and be able to utilize those rights in a country where we were all still minors, we were able to be brought back, and we were brought back into foster care because we didn't have any parents that were able to care for us in America. And so come emancipation, I didn't really have family that I could, be emancipated to into their care. And I was doing well for myself because I was working about 4 or 5 jobs at the time. So it was okay. But at the same time, the uncertainty was still there, because even with the 4 or 5 jobs that I was working at the time, I was still depending on the services of foster care to be able to get me through, as far as being in CELA, which was a semi-independent living arrangement, which is also a different area of attaining self-sufficiency while you're 18 to 21. I was in a CELA arrangement, so they were still paying my rent, and I was just coming up with the utilities. So once that went away, it was kind of like, okay, do I have to work 7 jobs now to be able to? So with that being said, it was kind of a world shaker for me at that point, because time was flying by, and at the FEM, I didn't really have that many options. So I believe 6 months out, I went to a college fair, and I actually met a young lady that coincidentally was in the same program as me. And she explained to me that she was emancipating out in about a month or so, and that she was getting transferred into this program called FUP, where they give you a voucher and subsidize your rent and things of the nature. So when I heard that, you can imagine how excited and both, surprised I was to hear that there was a program like that, I'm pretty sure I would be eligible for. So I called my social worker after the fact, and, I wouldn't say called her out on it, but I just kind of mentioned it to try to figure out, why if she knew, well, one, if she knew anything about it, and two, why wasn't I informed about it? And so she was kind of a little hesitant and, basically stating that that's something that would be talked about closer to my emancipation date. But at this point, it's already about 6 months to my emancipation date. So I'm trying to figure out when is closer. And so I just requested that we hold another FEM. And at this FEM, I wanted to make sure that every possible supervisor was there, like everybody that would have to sign off on something like this. I wanted them there to kind of gain a cultural perspective with everybody in the room and to find out what this program is. And, they would have to tell me at this point because I know, and you can't hide from the fact that I know. So we had the FEM and, I asked about it and, they went into saying that I would be great for the program. It's just that they don't know if there are going to be any vouchers available at that time because it depends on, the money that is dispersed through policies and government and things of the nature. So with that being said, they wanted to wait until it was closer, probably about 90 days out from my emancipation to see if that was even an option, if a voucher would even be available at that moment. So I said, okay.
Dora?
Yes, go ahead, Ms. Ruthie.
Oh,
I have some questions actually too.
yeah. So this is the point of the story where I think it's important to point out that the social worker was trying to do everything she could do, but she didn't have the predictability built in. But it's also a really important point about self-advocacy. So yeah, so I wanted to say that. I also wanted to hand it over to Carrie for a couple of questions, but I also want to say we neglected to mention that in addition to being our communications consultant at NCHCW, Adora is also a double major at Bowie State University. So shout out to Bowie State. You have great students. Okay, Carrie, do you want to have a question?
Yeah, there's a couple of questions coming in. Adora, first of all, thank you so much for sharing your story. And I know that your experience is going to provide really helpful context to everybody on this call. So one of the questions that came in, and obviously you weren't in foster care during a pandemic because it's the first time we've ever experienced this, but what kind of services and supports would be most helpful if you could think back to when you were in care, if you were going through this, what are or what are you hearing from other young people? What supports and services would be most helpful in this time?
Well, first things first, I would say to obviously not have a lapse in payments or subsidies that any youth may be receiving, because I do understand that most people are working telecommunicatively, so that's very understandable. But at the same time, not all the youth see it like that. They kind of see it as if their bottoms are dropping out, like the floor is kind of crumbling from under them. And I can understand because I was at that type of point even, and I can imagine that it's worse for them now, the anxiety of not being able to go anywhere to work if they're not working, not being able to keep up with school, if they're not able to have internet where they may be living. Some youth did depend on computers in the library. Some youth even depend on their student, their cards that they have for food and stuff like that. So it just becomes like, every part of their life was kind of connected to everything they were receiving. So if a lapse could be avoided, I would, recommend that at all costs. Also, as far as communication goes between any workers and the youth and things of the sort, especially if youth are used to engaging with their workers on a regular basis, even if it's so much as trying to find out where where a doctor might be or anything like that, it's important to keep those connections available and open. Because for a lot of youth, the only family they have that are looking out for them are their workers. So if they feel disconnected to them, especially in a time like this, you wouldn't want any reoccurring fears or traumas or anxiety to come from feeling that they've been abandoned or anything like that. So that would definitely be a fine point as well. Anything else? I mean, as far as like help with schooling, some people depended on tutors that were in the tutoring center or anything like that, so that if they could feel some type of help from that aspect as well, because this is I'm in college, and so I understand the transition is very hard. If I have a lecture class that starts at the beginning of the semester, for it to just be kind of switched around to a fully online learning type of thing, and my teachers are just sending me information, but I'm used to hearing lectures and getting notes and asking questions that are right there. I can have that back and forth communication with my teachers. So I can imagine, there's a lot of youth that are going through some problems with that as well. Yeah, I think that would be my top three things.
I'm going to jump to another question because we have a bunch coming in, and maybe Ingrid and or Blair, if you guys could take this one. So we've talked a lot about what are the housing options and funding opportunities for youth who are in foster care. We have a lot of questions coming in about young people who are experiencing homelessness who are not a part of the foster care system, and what are some of the program and or funding streams to be able to help them during this time.
Could you repeat that again? It kind of like went out and then came back.
Oh, sorry. So Ingrid, did you hear me?
I think so. Okay. Blair, would it jump in, or do you want to go ahead? So I think the question was, what housing options are there right now for youth who are not connected with the foster care system? So of course there aren't enough. There are some resources for youth experiencing homelessness through local continuums of care that get funding from the U.S. Department of Housing and Urban Development, and runaway and homeless youth providers who get funding through the U.S. Department of Health and Human Services. But in terms of additional sort of crisis response resources right now, I think that unfortunately there's really been a perception since the onset of COVID-19 that this is something that's primarily impacting older adults, and that is true, but it's also true that for youth experiencing homelessness and people experiencing homelessness in general, they are high risk regardless of age. So youth experiencing homelessness might often not have access to safe sheltering options, places where they can do social distancing, adequate hygiene options so they can do hand washing frequently, follow all of that guidance, and they are likely to have underlying health conditions, even youth, right? Asthma, diabetes, malnutrition, weakened immune systems. These are all things that a lot of young people without stable housing are struggling with that make them more at risk. And, I think we're all aware that COVID-19, because of systemic racism, has disproportionately impacted Black and African Americans, LGBTQ young people. These are
great. Can I ask you to just lean in closer to the mic? We have folks that it's difficult to hear you. Thank you.
So sorry. Let me know if that's not better. You're going to get a real close up here. So we know that because of systemic racism, there are youth who are disproportionately likely to have conditions that make them at higher risk for COVID-19 and disproportionately likely to experience homelessness. So one thing I would say about housing options is that we all need to make sure that youth are not being left out of the COVID-19 response. The federal government issued billions of dollars through the CARES Act to states, and there was only $25 million allocated for runaway and homeless youth programs. So we need to be, lifting up the needs of youth experiencing homelessness, but also, Ruth talked before about funding like the Emergency Solutions Grant Program. We need to make sure that all of those resources that are being expanded right now are being used to meet the housing needs of youth, even though youth are, as they often are, being overlooked at this time. So, you know, the Emergency Solutions Grant Program can be used for immediate health needs, but it can also be used for a broad range of other things, including longer-term housing. So we need to be talking about longer-term housing right now, even though we're in a crisis, as we always should be. We need to be, you know, thinking about the recovery period from this crisis. A lot of states have eviction moratoriums in place right now. Those are going to be lifted, and it might not be that long before they are. And we could see a huge uptick in homelessness for youth and other folks in our communities. So we need to be talking about how to use ESG funding and other sources of funding to find long-term housing now. So that's sort of about how we can be really advocating at this time to expand housing resources. In terms of what's already available now, that depends on your continuum of care and how it's operating at this time. Whether there is housing available and what particular challenges there might be at getting people moved into that housing right now. So I'm in Baltimore City. We've had some bureaucratic difficulties between our continuum of care and our public housing authority around inspections that have caused people to not be able to move even into some housing that is available. So there could be really specific challenges that you kind of need to drill down and identify and address in your community that are relevant to COVID-19. And just really quickly, in terms of getting in and advocating about the use of funding right now, like ESG, usually that funding comes with public participation requirements. So local jurisdictions, states are required to have a plan for how that money is used, and they're supposed to release that for public comment. Part of the waivers that have happened is that the public participation requirements are waived. So that's for expediency, and that's a good thing, but it also means that there's a real risk that we're not going to focus on equity. I think it's important to remember that, you know, there's no reason that you can't make equitable decisions quickly. You've got to make sure that youth are at the table, youth of color, LGBTQ youth providers are at the table. So we have to, for all the providers and advocates, we have to really insert ourselves and try to help hold that space for youth so that we do use kind of the investment that's happening right now to end up with housing resources that youth need and that they want and that last beyond this crisis. Because we know that poverty is enough of a crisis, right? This is not the only time we should be innovating.
And I know that people were having a little bit of trouble hearing Ingrid, but we'll make sure that we send out resources. And obviously, if we need to clarify any part of the recording, we can do that when we send it out. Blair, quickly, did you have anything you want to mention about, you know, youth experiencing housing instability during this time that are not a part of?
Yeah, so I think the only thing I would add would be to pay attention to those like local COVID-19 emergency response resources that are popping up all over the country, and really get creative about how to do that and utilize those funds. So as Ingrid mentioned, it's pretty difficult right now to focus on young people getting access to shelter, where there's already a pretty limited shelter capacity for young people explicitly. And so we've been doing some kind of local collective organizing with a number of different organizations and service providers to build partnerships with hotels and landlords to get folks into emergency housing where the shelter system isn't able to do that at the moment. And so that's providing folks like safe inside space, right, to be, especially now during this pandemic, and making sure folks get access to food. Yeah.
I'm sorry, we had a specific question for you, and before
Yeah.
you get into the food part, so there was a question about talking about rapid rehousing, specifically during the COVID crisis. Would you be able to respond to that and then go into the food resources?
Yeah, sure. Yeah, so rapid rehousing, I think as folks mentioned, some of those dollars come through the continuum of cares locally and other resources. So I know HUD has waived kind of for us at least, as we've been working with some of our youth, some of our folks have gotten to that kind of 24-month point, but we've been allowed and sort of that have been waived to be able to keep folks in housing right now. So it's really, really, really important to just recognize that folks should be able to keep their folks in housing, especially during this time. And if that's not something that you're hearing locally, ask those questions. But from my understanding, that is something that can happen. And again, those landlord partnerships right now are probably more critical than ever because it's that rapport and those relationships you build with landlords to ensure that folks are not going to be evicted. And that you have the right resources and legal advocates if folks are getting eviction notices to be able to respond appropriately. So rapid rehousing is a huge, I think, space right now that we can be doing continued conversations and advocacy in keeping folks in housing and housing folks first, right? But then also having those other resources around legal supports if evictions and stuff do come through.
Great, thanks. A shout out to Adora. You're getting tons of comments about what a great job you did, and thanks for telling your story. And before we move on to Kim, there was one more question specifically about the independent living coordinators and foster care. And Adora, the question was specifically, what do you feel like independent living coordinators could do in order to better connect with youth during this time?
Well, definitely, I would say staying in contact. Maybe if they're not reaching out to you because they don't want to be a bother, just checking in maybe once a week at this time, just to see how they're doing. Just to kind of allow them to de-stress because a lot of youth are introverts, especially having gone through foster care system where a lot of them, haven't really felt connections with their foster parents. And now that they're aged out, they're pretty much keeping everything bottled in because they feel like nobody cares about it anyway. So I would just say, keeping out, reaching out and keeping in touch. Just checking on them, seeing how their head's going with school, work, just everyday life, if they're okay. And I think that'll go a long way.
Great, thanks, Adora. So Jay, I'll hand it back over to you and we can move on to Kim in the next part of our conversation.
Yeah, great. So now we're going to turn our focus to the topic of youth and young adults experiencing homelessness and housing instability who are pregnant or parenting. And we all know that this is a particularly challenging time for either one of those groups. We know that some of these youth also have foster care histories, and hopefully some of the resources we just discussed can apply to them. But Kim, as somebody that works regularly with youth and young adults who are parenting and experiencing homelessness or housing instability, I imagine you're seeing additional and different challenges right now. What are some of the strategies and approaches that these parents who are experiencing housing instability have found to be most helpful during these times and could be relevant across the country? Especially for folks that don't have access to something like a therapeutic nursery. And by the way, while Kim is sharing with us, box, share your strategies or approaches you've found helpful for dealing with parenting or pregnant youth who are experiencing housing instability. So Kim? Are you there, Kim? We can't hear you.
You're
Okay,
muted.
hold on.
There you go. That's good.
Now we can hear you. Yep.
You can hear me now? Can you still hear me? You can?
Yep, we can hear you.
Okay, good. I'm actually going to pull part of this out because I'm getting an echo weird thing going on. I think one of the things that we oftentimes realize is that being homeless is difficult, right? You can only imagine if we've experienced inadequate housing or doubling up with others or just literally being on the street, you can actually envision what that would be like as an adult. I think oftentimes we forget that even our littlest ones are impacted. Babies are really, really impacted. And ACEs has helped us realize that they carry it with them through their life, right? It's not uncommon for me to hear from people who know about this kind of work and they know about homeless populations and adults and families. And they'll oftentimes say, well, it's just a baby, so that baby really won't remember this. Well, they do. And it really can impact their development. Um, One of the things that we know from all of the research is that one thing that can make a long-term difference is relationship, right? Adora, you sort of spoke to that connection you feel with others, right? In foster care, if you felt connected to your foster family, welcomed and accepted, and there was just this right feel to it, wow, what a different life is, right? For babies, that's the same thing. If you're impacted by a significant life trauma, even as a baby, if you're able to have that relationship, that matters. Now, one of the challenges is that's not always easy. It's not always easy because we all have our own struggles from our own childhood that we may be facing. Being homeless adds an extra layer onto that space. It's funny. One thing that always sticks in my mind is if you ever hear about businesses or like real estate agents, their favorite thing to say is location, 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 right? For our work with young children, it really is relationship, relationship, relationship. So there are a number of interventions out there that we have found and families have found particularly helpful. And the reason that they find them so helpful is because they're really relationship based. Some of them are like Circle of Security. You can actually go on their website and find some resources as parents. One of the gold standards in working with young children with trauma is child parent psychotherapy. ABC intervention is also really, really helpful. Promoting first relationships is another one out of Seattle, Washington. And then also an intervention that's more than an intervention, it's really about family engagement. It's called the FAN, Facilitated Attuned Interaction. All of those have a relationship-based element to it. Now, the challenge is you may or may not be able to get that intervention through telehealth. So I think it's absolutely possible to get those through telehealth. But really, one of the things that I think, whether you're a trained clinician in these interventions or any provider and any human being can recognize that really what matters is how do we connect with our little ones, right? And especially in just the day-to-day moment interactions that we have. How do we help our baby feel safe and secure? Well, we hold them when they cry, right? If they need to be fed, we feed them, and hopefully we're having families get the resources they need to be able to feed their young children. That's certainly a huge concern right now with COVID. Everybody is struggling with that, but in particular, young families. How you change your diaper for your child, rather than it being a task that you just complete, take a moment and notice your baby. How are they? Are they smiling up at you? That's a chance to smile back because when you share your delight in whatever they're doing, whether it's you're changing their diaper, you're giving them a bath, you're playing with just some simple toys. We all know that you don't have to have fancy toys for kids to love to explore. They can very simply have a box, some cotton balls, and have a good time. So really, it's being able to support parents to just pause on occasion to really be mindful about where they are, how they're feeling. Oftentimes, we as parents have the ugliest interactions when we're frustrated, when we're angry. So really making sure that we bring compassion and care to ourselves, to the families and parents we're working with, so that that sort of funnels down to our children. Because ultimately, it doesn't always matter the fancy toys you have, but really if a parent is just being a curious observer of that little one's curious exploration and letting them be in charge of that and just sharing love and delight.
Thanks.
Go ahead.
Thanks so much. Thanks so much for sharing. We have a question that the biggest need right now among youth who are parenting and experiencing instability is access to basic care items, diapers, wipes, basic needs. What are some ways to get those basic needs met that you've come across in both Maryland and if you know of some other resources nationally?
I think that really looking at if there are diaper banks in your community, being able to reach out to them, if you have a United Way, if you have a 211 or a 311 call that you can say, hey, I need these resources, that's a great thing to do. Agencies, a lot of early Head Starts are, many of them are closed. We're an early Head Start, yet we're still reaching out to families on a daily basis, trying to provide supports to them as a parent, health supports, and also basic needs. So a lot of the funding there's some flexibility to be able to provide those kind of supports right now. So really look at the places that you would normally go to. If you can reach out to, if you have a healthcare for the homeless agency, reach out to them. Reach out to WIC if you have a WIC number to see if there's any supports that they can provide, because we'd be surprised there are. Sometimes
Great.
it's so exhausting to make all those calls and to feel disheartened when you don't have a solution right away. The thing that I would encourage all of us to do, including our families and youth, is when you're starting to feel really down, just take a moment, take a breath. Remember, we are all in this together, and we're all doing the best we can. And if we make sure we bring kindness to our interactions, people will feel uplifted.
Great.
That's not always easy to do.
Thanks, Kim. So we do have some resources that are being posted in the chat box. There has been guidance issued by the Children's Bureau about how to access cell phones for youth who are in care. Blair, can you talk a little bit about what you've been doing to make sure that you have cell phone access to young people who are not a part of the foster care system and can access them through the use of Chafee funds?
Yeah, sure. So connectivity we found pretty quickly was a huge gap that we were seeing, and just making sure that our folks were able to reach us, right, or reach each other. So I could not really imagine personally what it would mean to not have access to the internet and not have a phone right now to connect to the people around me, to my friends, to my family, to resources, to mental health, to all of that. And so many of our young people don't have that, right? And so we found it really important to just start thinking about ways to get phones into folks' hands pretty quickly. And so started applying for funding, built some partnerships, and we're now have some cell phones in hands. And actually right after this webinar, I'm running to our drop-in center. We have hours today from 2 to 4 to be able to give some of those phones out. And we're paying for service plans for 3 to 4 months. To just give folks the opportunity to stay in touch with us, to get connected to resources in their communities, to stay in touch with each other. And we started doing this virtual group actually that we do in person in our drop-in center, which is called Self. It's this conversation about safety, emotions, loss, and future, and very much kind of attuned to what Kim was mentioning, really helping folks get grounded, understand what emotions are coming up, and just find community and figure out how to cope. And so having folks have that access to those cell phones will be able to have them engage in those spaces and be able to just be present and be able to find community and to build. And this time where we feel really distant from one another.
Thanks. And just to follow up on that, Blair, what have you found has been the participation levels of your virtual contacts, either through phone or the Self virtual meeting with young people? And do you feel what the participation levels are versus what it is in person? Like how many in a percentage of the young people that you usually are in contact with, do you feel like are taking advantage of those opportunities?
Yeah, actually seeing a good number of folks take advantage. And so typically we would have it once a week in the center and keep the group pretty small to have really good discussion. But now that we're virtual, we're having them twice a week. We're having like 10 to 12 folks join a week. We're going to start doing a third group in the next couple of weeks, and really just making it more accessible. So we're seeing folks want it and really want to be a part of it. And part of what we also really think is important in that process is, even as we're creating that space, always really wanted to make sure that folks were getting some sort of payment for their time, for their contributing themselves to the space, for being vulnerable, for offering resources, for connecting. And so we also provide some stipends to folks for their participation in that space as well, that we're also getting out to people throughout the month. And so I think that's also a really critical piece to make sure that as folks don't have income right now, that's another way to kind of bring some of that to them.
Great, thanks.
You mind if I add on to that a little bit? This is Kim.
Go for it. Yes.
Okay. I think Blair's absolutely right. It is remarkable. We were lucky enough to have some connections within the community and give some laptops with hotspots and all that kind of stuff. And each community, I think, throughout our country is these tech people are really smart. They seem to be able to resolve those kind of techie issues with much more ease than some of us other folks. So I think that has really helped. I do think also you have to sort of meet families where they are. If somebody doesn't have a laptop, then maybe they respond to text messages. So the communication sometimes, maybe families don't want to use their minutes to have a 45-minute call with you, but they would love to hear from their teachers in their early Head Start, or in the community program that they involve in. And I think one of the things that's unique about this, especially when you have young children, is early childhood, we're oftentimes used to dealing with separation anxiety with parents and children, right? Well, this is separation anxiety between families and their providers. And so being able to, even if it's a still photo with an encouraging word that's mailed to somebody, if they are in another program, or it's put on Facebook, something like that is really helpful. The other thing that I think you have to be particularly sensitive about is a lot of families who are experiencing challenges with housing don't have a lot of arts and crafts stuff that they can pull out, right? So really thinking of, if you're doing activities, have them be activities that you really don't need anything. Initially we really focused on not even having crayons or paper, so a lot of movement kind of things. And I think if we think about that, even if a mom has a newborn or a young baby, doing dancing together, one, it builds connections between them, and two, it helps their body release some of the stress that they're going through. So I think people are being really creative and bringing it to them. And the other thing is, whatever you do, don't give up on these families, because they may not respond to the email or the text, but something may come across Facebook that they notice, and they may respond on Facebook with a thumbs up. And just really respecting that they may be feeling really overwhelmed. And so you really do have to meet them where they are.
Great, thanks. We have another question for Blair and or Kim. What type of first step programs are available to help new moms live on their own?
I'll let you go with that one, Kim.
Well, I think that there's a lot of, in various health departments in Baltimore, there's Be More for Babies, and a lot of programs that help moms. There's a lot of home visiting programs. Healthy Families is a great program. So there's a lot out in the community. My suspicion is that the team here is going to put up a whole bunch of different places that people can call. I do think one thing to remember is that programs may not be quote unquote open, but they're still providing services, right? So they may not be able to do home visits, but they certainly can do an intake for a mom. There are community resources out there that you may think, oh, I can't access this right now, but really you probably can.
So this is a question really for anyone. You know, as professionals, as helping professionals, this is a really stressful time. You know, we're all juggling being homeschool teachers, plus our own work, plus just the added stress of possible health issues. What and anyone can answer this. What are you guys doing to help support your staff during this time in doing this really challenging work on a typical day? And then you add the level of their own personal health concerns or family concerns that just amplify. So if you could talk a little bit about what you're doing for your own staff.
This is Kim. I'd be happy to sort of speak to that a little bit. So I do think that one of the things about being trauma informed is to remember that trauma knows no boundaries. It's sort of like the virus. What happens to a family when it's shared with providers, we carry that with us, right? We carry that in our heart. And so finding ways to be able to manage that yourself. I will say the model that we have used to really support that sort of engagement and also take care of ourselves, the FAN model, which is out of the Erickson Institute in Chicago, has a whole element of it about mindful self-regulation. And in our program, we've used mindfulness for probably almost 12 years. And, you know, mindfulness 12 or 15 years ago was sort of, what's that? Is that a hippie thing? But really being able to bring a mindful presence to your life is really important. So we do a lot of that when we meet with our staff virtually to be able to open every meeting up with just a mindful pause so that we can gather together. And then to end with some reflections is always really important. And the other thing to do, and this is, I think, out there throughout this COVID experience and people working from home, one thing is we're probably all much more exhausted, and I think we all know why, because people are juggling a lot. And the trauma of this experience, we're in a state of constant alert, right? Our brains are going all the time thinking, how do I not get infected? How do I reach out to families creative? I mean, we're just in this constant fight, flight, mode. And so really making sure that we pay attention to our body messaging. I'm sure everybody on this call has been on a million Zoom or whatever calls, and I don't know about you, but my neck is a little so making sure that you do something for you. Pay attention to your body, listen to your body messaging, pause throughout the day, and try to take care of that. The other piece that I think is really critical is make sure you have a routine and try to stick to it, right? Everybody is recommending if you're working from home and, get up, get dressed, take a shower. When the day ends, finish your day, get off your Zoom calls, go for a walk if your community still allows that. If that's not an option, do some, relaxation, stretch, do some push-ups, do something that notes the end of your day that you can say, okay, I'm going to put this away. And if you do feel like I've got to check my emails again, try to do it in a limited time later on. Try not to be, and I'm certainly guilty of it. It's 12 o'clock and you just remembered something and you're now pulling out your computer to send an email. So I think as we get into the grind of this, the more we can put structure and routine in our own lives so that we can be balanced, the more support we'll be able to be to families.
Claire, did you want to add anything about what you're providing for your staff?
Yeah, I think I just echo a lot of what Kim mentioned. Actually, Kim is one of our coaches actually around that FAN model, which she's been working really close with us along with Kate to try to implement that in our space. Yeah, I think it's hard, and I think we're figuring it out week by week, day by day, hour by hour. Honestly, it feels incredibly challenging, and just want to honor that. The stress headache I'm fighting right now is I'm drinking some water and trying to stay fully present. Yeah, I think it's just really important to, we're lucky to have, again, my coaches that are really supporting us through that and integrating some of that in some of our case conferencing meetings, making sure that we're doing emotional check-ins when we have staff meetings on a weekly basis and just seeing where folks are at. There is a like self-care, like once a week offering that we found locally where a local person who has been doing work with nonprofits across the city is just offering like an hour on Zoom for stretching and for meditation, guided meditation. And so we're like holding that space on our weekly calendar to make sure that if people want to opt into that, they definitely can. Encouraging folks to go outside and just like take space where they can. I think are some of the things we're trying. And you know, some weeks it's great, some weeks it's not, but doing what we can.
Great.
Can I add on to that too a little bit?
Yeah, yeah, sure.
Sorry, Blair, you're singing my tunes there, dude. I think one thing that, and I'm going back into ancient days, but Mr. Rogers sort of said, and Blair, I so appreciate that you said we need to honor that this is hard and that we're struggling as well. I think that that's what makes this such a unique situation, and it's long term. This isn't going away in a week, in a month. This is going to be something that's going to be with us for quite a while in waves that we have no idea, and that unpredictability is difficult. So Mr. Rogers, I'm probably going to quote him incorrectly, but always said, you know, if you can talk about it, if you can mention it, you can manage it. So I think that is really critical about everything, about, you know, if we're feeling that there's inequities that are going on in this process, I think we all know that there are families who are literally starving. And they're, you know, this is really, really hard. And so how we approach that is critical. We have to talk about it. We have to mention it.
Yeah, and I also just wanted to call out, somebody made a great comment in the box about employee assistance programs, and most organizations have them. And so please reach out to your employee assistance program. And there's some really innovative, cool things at the university. Exercise gym program here has opened up all their classes online for free. You don't have to be a member. So even if you have looked before this pandemic happened, I'd look again, because they are offering additional resources specifically in response to the pandemic. So I want to switch gears a little bit. Ruthie, sorry, I see you just took a bite of your piece of fruit, but a second to chew while I ask the question. Can you just, you and or Ingrid and Adora, can you talk a little bit about the advocacy that's happening both at the federal levels and if anybody, you know, can speak to a particular state that's doing something really innovative in response to this to address the needs of youth and young adults who are experiencing housing instability?
I'm done with my strawberry, so I'll jump in and just say there's a lot of advocacy going on. I will say this: for some reason, child welfare advocates sort of took a back seat when it came to the last package that just passed. So homeless advocates did a great job. They got $4 billion. $2 billion of it has already gone out to communities. $2 more billion is coming. And like I said, there's these weekly office hour sessions that are a gold mine of information about how you can do what Ingrid said you should do, which is go to your continuum of care and say, I'm on to you. You've avoided serving youth for years, but you have $4 billion. So the $25 billion Runaway and Homeless Youth Act providers is much too low, but that's almost like just a down payment on the fact that $4 billion is available. And the guardrails have been taken off to a large degree, but that it can also be turned into, and it must be turned into, an opportunity. And that's on us to make those demands. Like I said, I work with the Chicago Coalition for the Homeless last night to take care of this with a young person. So that's part of the advocacy. But the child welfare advocates did take a back seat. $45 million was made available, however, in assistance for families. That's concrete assistance. So I'm seeing a lot of questions come in about like diapers and hotel rooms and everything. Child welfare has that money. So go to DSS nationwide, or whatever you call it, DCF in your community, and ask them where that $45 million is. Okay, so there's that. But now we're on to CARES. It's going to be called CARES 2. It's the fourth COVID bill. That bill should include an increase in Chafee dollars, a ton of money for child welfare. So I would really tune into maybe the Children's Defense Fund. There's a Google sheet making its way around. If you contact me, I'm sure you guys have my email. provided. I can get you onto that Google sheet, but so can the Children's Defense Fund. But I just want to add, there's also an administrative request, because a lot of there are some things that the Children's Bureau could do in the form of waivers that, as I said, HUD issued mega waivers. HHS has issued some good stuff on technology and some good stuff on the courts and remote access, and they're trying to keep family visits going. It's great, but nothing's come out about you. Okay, I find that appalling. So there is a request to Jerry Milner at the Children's Bureau to do something that is a little more robust on youth. But at the same time, I thanked him for acknowledging there's little that the Children's Bureau can do. It's really up to the states. So you can go to our website, or you can, again, contact me directly. The Institute has information. The states have latitude here to make sure that youth are safe and responded to, and we're happy to walk them through that process. But that's what's going on, and then I'll hand it over to Ingrid to talk about advocacy, making sure youth get a seat at the table, and youth providers for homeless services.
Okay, so I have changed my audio source. Can you hear me better this time? Okay, cool. So on the foster care piece, there has been advocacy, I think, in a number of states, including Maryland, to institute moratoriums on youth aging out of foster care at this time. So in Maryland, our Human Services Agency has directed local departments of social services not to discharge youth through June. That is, of course, completely inadequate as a time frame. Even when sort of the crisis period ends, however, I don't know how we'll know when that is, but when government starts making decisions that this is over, the economic impact of this is going to go on for a long time. So things like, moratorium on youth aging out are things that we need to advocate for to extend. So that's one kind of immediate advocacy goal that I think is very straightforward, that people in states across the country should be focusing on. But we also talked about, and this is something that that youth have been very involved with. A lot of the national youth organizing groups have been really focused on this, and I think actually Illinois was maybe the first state who instituted this, and it was youth, youth in foster care and foster care alumni who really helped push to make that happen. But we've been talking a lot about basic needs, food insecurity, needing diapers, needing things like that. So another area where there have been a lot of really important waivers is in public benefit programs, safety net programs. So we've talked about housing waivers, the need for more child welfare waivers. There have been really important waivers for the TANF and SNAP programs, so welfare benefits and food stamps. This varies from state to state. States have to request the waivers from the federal agencies, but for example, many states are waiving work requirements for TANF, along with a lot of other requirements. They're waiving a lot of the application requirements for food stamps. They are taking advantage of opportunities to maximize food stamp benefits. So even if you have some income, you should receive the full benefit amount for your household size. That's been extended at this point, I think just yesterday, through June, and hopefully will continue to be extended. There's also something called PEBT, Pandemic EBT, that allows families who had not been receiving SNAP, regardless of their whether they're already receiving SNAP, to receive a benefit for any school-age children who would be receiving meals in school. So if you don't know already, I would find out whether your state is taking advantage of all of these waivers, and if they're not, advocate for them to do so. In Maryland, advocates have had a twice weekly call with our Human Services Agency to get real-time information about the waivers, to share what we're seeing on the ground. Our Human Services Agency has seen a 500% increase in SNAP applications. And so we've really been pushing for them to focus on people experiencing homelessness and make sure that they're not left out, including youth. So this is another just area for a lot of opportunity in getting people access to resources for food and basic needs. And I think there are some resources that are going to be shared with you about that as well. Carrie, you're on mute.
Sorry. Ruthie, has anyone received a mega waiver?
Oh, so the mega waiver document means any community can apply for waivers for various different things. So you wouldn't get a mega waiver. But yeah, those waiver requests are coming in and HUD is approving them quickly.
More information out about that.
Put our Carrie, our fact sheet on how that pertains to youth and a link to the document is in the chat box.
Yep, great. So let's just give sort of a big wrap up kind of question, and anyone can jump in. We have, about 10 minutes left, 5 minutes of question and answer. A really great question came in about one of the silver linings of this whole pandemic is that community-based services that are serving individuals across the lifespan have really worked together and partnered and collaborated in a way that they hadn't previously. And so what are some of your thoughts and comments about how we can keep that kind of partnership going? And really, it is going to be probably more so than ever a time to work smarter, not harder, and be able to join forces in order to get to the same ends as a result of budget cuts or funding scarcities. So what are some of your thoughts on how we can continue to work together and keep the silos that have really been taken down as a result of this out of an emergent need, just when things do go back to whatever the new normal is going to be? Anyone can jump in.
I'll jump in. This is Ruthie. It's the weird silver lining, I think, is that we're all very comfortable in this format. So like this morning, we had a call with, this isn't really about the cradle to grave nature of all of this. It's really more about, multi-systems work. We had a call this morning with 3 Maryland housing authorities and 3 Maryland. And we had a great time on the phone. We didn't have video, we just did phone. And it's so, no one had to drive anywhere, no one had to do anything. So I think this use of technology is really, really important. But to your question about working across the various, ages, I find that really intriguing because now we have homeless services providers talking to us about how these young people in foster care shouldn't know where a shelter is unless they want to volunteer there. Like there are kids, we took them from their families. So like everybody is starting to talk amongst themselves about how the coordination can lead to closing the gaps through which you fall into homelessness altogether. And I'm all for it. I hate that we're dealing with this huge tragedy in our country, but if we can turn it into something positive, I'm all for it. So that's a great question, Carrie. Thank you.
Yeah, I think to that point also, it's just been really important for us to figure out and really talk about like where our expertise lies and where our capacity is, and then really kind of calling on our partners that have different expertise and different capacity availability, and just like really kind of working together around making sure folks have mental health support, making sure that folks have access to income, making sure that folks have access to legal support as they need that. And it's just I know it's a really important time. It's hard right now, and I keep saying that it is because it very much is. And I think it's a good opportunity to sort of revision and kind of rebuild a world that actually is meant for us, right? From a really like justice-oriented space. And so it's critical for those silos to be broken down. It's critical for us to be talking to each other about the service we're providing to our folks. It's critical to demand for more. Yeah, because we all deserve it.
Yeah, hi, this is Kim. I think you know, as we're sitting here, I think of, you know, my world is baby world. I love baby world and mom's and dad's world and aunties and maybe grandparents. But I think that this crisis has really caused us to remember we're all human, and everyone is impacted. And how do we make sure that we pull our resources together in a way where it's, oh, I gotta save for myself so that I'm not short. But how do we learn to make sure we've got what we need, but then also share with others? And it may be resources, it may be trainings, it may be sharing, who knows what. But being there for each other is really what matters. And being there in a way of care, compassion, and kindness really is going to make this a better world. And that's my hope, is that all of the providers can remember that we're all in this to make sure that people's needs are being met.
Another great comment, just in that not only silos across agencies, but also that this pandemic has highlighted the fact that individuals who work in the helping profession have had to kind of change their role. You know, social workers, foster care social workers have had to take on different roles in order to meet the needs of young people because of the limited community resources availability to their young people. So I think that was an interesting point as well. Adora, I just want to give you the last word. And if whether you want to speak directly to those who are working with youth in foster care, or from your experience in nationally doing national advocacy work, what's one thing that you would want to tell those that are working with young people?
I would definitely advocate for, you know, building those lasting connections. As far as you know, getting through to youth, you know, breaking those barriers that they may have built up over the years, because you never know when you might need those youth, you know, expertise on things like that. Because I ended up here because of the connections that I formed with my social workers and, you know, people that they helped me to network with. And that's how I even ended up meeting Miss Ruthie. It happened to be a conference that I was recommended for through an old social worker of mine when I was in foster care. And this was 3 years later after I had emancipated. So you can imagine how those connections could really propel youth, and how, you know, and how secure they would feel to be able to have people like that looking out for them, whether they're gone or, you know, whether they've kind of hit a hard spot or anything like that. And I'd also say to, you know, keep working on yourselves as far as, you know, policies that you guys have within any organizations that you may be working with or owning or, you know, overseeing. It just helps to keep kind of stay up with the times. I believe Blair had mentioned it. He was saying that it is important to forge a path in this type of time, because with this pandemic, I don't really think we'll ever get to 100% normalcy as we used to know it. So in order to better equip ourselves for the future, it's best to think of it now and kind of, you know, think of these things that we're doing now as long-term things versus us just doing it until the pandemic is over, which we never really know when it's going to fully be over anyway. So I think that is important as well. And also just, you know, sharing the love and just letting everybody know that they're cared for and appreciated, and, you know, that us working together is for the bigger picture. And I think that, you know, kind of wraps up what I feel about that.
That's awesome. I knew you were the right person to end with. Feel the love, everybody. I'm going to quickly pass it off to Denise, who will do our quick wrap up. I cannot thank you enough for joining us, and panelists, thank you for your expertise, and take care of yourselves too.
Thank you, Carrie. And thank you, Adora. You truly left us with smiles on our faces and feeling love. On behalf of we really appreciate it. On behalf of the Institute, I'd like to thank all of you for participating today. Both our panelists and your active sharing in the chat box have demonstrated that together we are truly stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. Thank you all for your commitment to supporting persons experiencing homelessness and housing instability during COVID-19. And please continue to take care of yourselves while taking care of others. Thank you, everybody. Enjoy your weekend. Stay safe and happy.